Dr. Christopher Okunseri, President of the Association of Nigerian Physicians in the Americas. I am a dentist who is a full professor in dental public health at Marquette University School of Dentistry. I can tell you that I was born and bred in this city, Benin City. Born and bred in this city. Went to primary school here, secondary school here, university here, graduated over 30 years ago. And all through this period, Nigeria as a country basically changed as the years progressed. Changed for the worse, quite honestly. But my incentive for leaving, quite honestly, was to improve on my career. Because when I left this country and went straight to a postgraduate institution in London. Immediately I got an admission to do a master's in dental public health at the Eastman Dental Institute, the only postgraduate institute in Europe in my profession. So I was fortunate to be able to afford to go to the Eastman Dental Institute in London, where I did a master's in dental public health and also was able to do a diploma in dental public health that was awarded by the Royal College of Surgeons in England. But I did not stop there. Before I moved over to the United States and completed the residency program. And today, I'm a professor in dentistry, continue to do clinical care, teaching, and research. A lot of observations, I would say. One that has been really clear is the level of need in our city or in our state. This is beyond anecdotal. We really have empirical data to support the level of need. That's number one. Number two, it has also been glaring that there is also inadequate access to medical and dental care. So we can see the depth of the burden of disease, we can see the problem with inadequate access to care, and we can see the impact of social determinant of health. When we talk about social determinant of health, we're talking about the environmental factors, neighborhood factors, socioeconomic factors. All of this, quite honestly, if not addressed, will increase the burden of disease, will create disparities, and will create inadequate access to medical and dental care. At the individual level, quite honestly, it's not easy if you don't have the resources. But I think at the individual level, we can continue to live, we can try and adopt a healthy lifestyle. And I mean that by saying, without putting too much burden on individuals, well, we can live a healthy lifestyle by actually starting. We have fertile ground to grow our own food. Grow our own food, eat healthy, exercise, at least moderate exercise, and somehow if we can grow our own food, moderate exercise, we can begin to reduce the burden of chronic conditions. Then let's go to the government. The government needs to understand that it is their responsibility to provide an enabling environment for its citizens. Simple things like power, water, and good roads are essential to quality of life. So I would hope that the government would see the need for the provision of all of this I have just enumerated.
Thank you very much. Any specific recommendations for health workers, probably for their work culture and for health institutions as well?
It's a challenge to see what happens in the health sector. But I would also be the first to be very careful in trying to apportion blame to the health worker. Because when you are in a challenging environment, a lot of things will happen. So, what am I trying to say in a nutshell? We need to create environments that are conducive to provide care to our patients. Government and institutions need to recognize the need for adequate compensation, need for acknowledging healthcare workers when they do things. Money is not everything, but acknowledging what people do could be something that is worth more than a certain amount of money. So acknowledge, get everybody engaged in continued professional development, pay fairly reasonable wage based on standard of living in the country, not based on any hypothetical or trying to compare yourself to the United States or England. Pay competitive wage within the context of the economy of the country in relation to the professional status of that individual is the responsibility of the institution vis-a-vis responsibility of the country